So it's mainly testing the upper cervical. Nothing to do with the C3, C4, C5. It's nothing to do with that. It's mainly testing the upper cervical spine. So what you need to do is mainly stabilize the distal component of the bone. So the distal component you're going to stabilize here is a C2 vertebrae. You're going to do this test in 3 different positions. You're going to do it in neutral, you're going to do it in slight flexion, and you're going to do it in extension. Are you with me? So you're going to do it in 3 different positions. So you're creating flexion, neutral, and then in extension as well. So your hand position is like a pinch grip. Your hand position is like a pinch grip. You're holding onto the sides of the C2 spinous process. Jack, if you could follow me, just pass that skeleton for me. Jeff, is it okay if you just place that next to you?
Yeah, put it on me. Yeah.
So basically, you got a pinch grip, and your pinch grip goes, palpate the C2 spinous process. Once you palpate the C2 spinous process, your pinch grip goes and holds and stabilizes the C2 vertebrae. You got me? So once you stabilize the C2 vertebrae, you apply a compression force, and you're trying to create a side bending moment. You're creating a side bending moment and comparing on both sides, trying to see if one side has got greater mobility or compared to the other side. You're also trying to see if it reproduces the original signs and symptoms when you're stretching the ligament. So that's the first step, yeah? You got me? Right. So if you got any problem, let me know, yeah? So first come from the occipital bone. You palpate the C2 spinous process. Once you palpate the C2 spinous process, you go on to the sides of the C2 spinous process. So pinch the C2 spinous process in its place, and then try to create in the neutral cervical spine, apply compression force, and then try to create a side bending moment. Okay, and then test that on the other side as well. Just relax. Is it okay, Joe? Yeah? You got me? So that's a neutral. So you can create that flexion, apply some compression, and then you can create that side bending as well. Is it okay, Joe? And then create that side flexion. So you're checking the mobility. So you're checking the mobility as well as trying to see if it reproduces the original symptoms. Okay? Get the cervical spine in extension, hold that spinous process, apply that compression force, and then create that kind of side flexion. And then check the mobility and trying to see if it reproduces symptoms. If that doesn't reproduce symptoms, then you go on to the next stage where you're creating rotation. So again, relax. So relax. So again, pinch the C2 spinous process and then create some kind of rotation. Come back to neutral. So create the rotation onto the upper cervical spine and then come back. So again, hold the other side, pinch the spinous process and then create rotation. So it's basically you're stretching that Alar ligament on both sides. Come back. Try that again on spine in neutral, pinch the spinous process and then creating that kind of rotation. Come back. Yeah?
So the first time it was the side flexion.
First one is a side flexion, the next one is the rotation.
And you do that in neutral, extension and flexion.
3 different positions, yes. So basically you're trying to stretch the different types of fibers.
Right.
You got me? And do the same thing. So it is different to some kind of rotation because you're stabilizing that C2 spinous process. You should not try to get like a maximum rotation, but then rotation as much as it could come from C2 to C1 vertebrae. So pinch the C2 spinous process, even if it's a little bit of rotation. If that's the maximum rotation is possible, you're trying to test that kind of rotation from that. Come back and then trying to test the other side. So that's why it's important you're trying to specifically stretch the alar ligament by creating side flexion as well as the rotation of the cervical spine. You got me? Do you want to give a try? The transverse ligament test and alar ligament test before we move on?